Taking care of newborn babies is always a problem because with the complex heart disease also comes other complications which we have to work together as a team. This needs a hospital with all facilities and a team which is capable of handling everything, and also lab and radiological support. Now this baby of Dillipriya had come with not only a complex heart disease needing surgery, but also had an infection in the bloodstream and also fits, for which all the investigations had to be done and the treatment timed in such a way that the infection was cleared, the fits was treated before the baby went for surgery. That is why MGM Children's Hospital is a capable place to handle all these issues. We also realized that the baby had blood culture showing a germ growing, which is a very serious condition because that does not augur well for the baby at all, and especially if the baby has to go for a major cardiac surgery.
Transposition of great arteries, which is one of the common neonatal conditions requiring urgent cardiac surgery, needs a coordinated team effort. As Dr. Binu was telling, one of the main reasons it's important is that the surgery needs to be performed within 2 weeks to have good outcomes. Otherwise, the ventricle, the heart, slowly becomes weak over time, and even after a successful surgery, the child may not survive. Decision making in this child was difficult because when you have a child with seizure and bloodstream going Acinetobacter, which is one of the deadliest bugs, if you operate child under this condition, they can develop a condition called inflammatory reactions syndrome. The child may bloat up, and in spite of good surgery, they can end up losing life. Thankfully, with the team effort, we could control the seizures, and we got the culture report within the 24 hours. We could start antibiotics, and after making sure that the CRP level, which is a marker of how severe the infection is, it's coming down, we went ahead with the surgery. And thankfully, with good team effort, we could the surgery went on well. The child had a smooth post-operative course, and we managed to continue antibiotic for the stipulated period of time, and the child is doing well now.
And after such complicated surgeries, these babies always require intensive care for at least a few days, when we have to keep track of some basic parameters in a very closely well monitored manner. So this baby, like most other babies who undergo cardiac surgeries, also had complex problems in the post-operative phase, which includes like dysfunction of the heart, which has just gone through a complex surgery in the theatre, and a requirement of lots of medications to maintain adequate blood circulation in the body, and adequate ventilator support to provide for the baby until the baby gains capacity to breathe by himself, and cover with antibiotics because this baby also had bloodstream infection with a highly resistant bug. We had to use one of the unusual antibiotics to treat this baby, and of course we had to continue medicines for the baby's fits as well, so that it doesn't recur after such a complicated surgery as well. And added to these, this surgery had taken place during the peak COVID season, when the entire country was reeling under high pressure and all the health systems were overwhelmed. Of course, we were also facing similar issues, but it was because of the well-established safety infectious control protocols and the quality management guidelines that we have in MGM Healthcare that we were able to safely perform this complicated surgery on time to ensure a good successful outcome.
Hi, I am Prabhu. I am from Orani, and I have a newborn child right now. She is suffering from TGA. It's called a transposition of great arteries. Initially, I don't know what to do on these positions, but I got a doctor at MGM Healthcare, Mr. Ganapathy. He only gave me a suggestion for doing a treatment like this. So based on that, I can move with Mr. Dr. Ganapathy at MGM Healthcare. Right now, my baby was safe with done a surgery at MGM Healthcare. Baby was born on June 2nd, 2021. I came to know this problem while I done a scan on 5th month of scan. I know my baby is having a TGA. After that, I plan to move. We have to get the treatment. Where we have to get the treatment, I have also planned with my wife also. I came to know I talked with the other doctors also. They suggested that MGM is a number one on this heart surgery. So I can move on with their suggestions. I can came here. Mr. Dr. Ganapathy also helped me to save my daughter. Right now my daughter is after surgery she is safe right now with our family. எல்லாரோட பேரண்ட்ஸும் வந்து இந்த மாதிரி டவுட் ஏதாவது இருந்துச்சுன்னா நீங்கள் எம்ஜிஎம்மில் ட்ரீட்மெண்ட் எடுத்துக்கலாம் அப்படின்றத என் சைட்லேருந்து நான் எல்லாருக்கும் கேட்டுக்கிறேன்.